Hello, it's Dr. Yazdani here. In this episode, I'm going to talk about reflux in babies. Reflux is when a baby brings up milk or is sick during or shortly after feeding. Reflux usually starts before a baby is 8 weeks. It usually happens because the muscles at the base of your baby's food pipe have not fully developed, so milk can come back up easily. These muscles will develop as the baby gets older, and they should grow out of it usually by the age of 1. Here are some of the symptoms of reflux. Bringing up milk or being sick during or after feeding. Hiccups, coughing, or being unsettled during feeding. Crying, and not gaining weight as well as expected. Sometimes babies have reflux, but they don't vomit. This is known as silent reflux. There are certain things you can try to ease reflux in babies, but remember, your baby does not always need to be seen by a doctor if they have reflux, as long as they're happy, healthy, and gaining weight. If your baby has reflux, there's a number of things you can do. For starters, you can ask a health visitor for advice. You can also get advice about the best position to breastfeed or bottle feed your child. Hold your baby upright during feeding and for as long as possible after feeding. If you're using formula, give smaller feeds more often. And make sure your baby sleeps flat on their back. If your baby has reflux and is not improving after 2 weeks of trying different ways to ease reflux, or if it's their first reflux after they're 6 months old, you need to see your family doctor. Also, if your little one is older than 1 year and they're still having reflux, or if they're not gaining weight, you should see your doctor. If your baby's vomits look green or yellow, or if it contains blood, or if you see blood in the poo, you must seek help early. A swollen or tender tummy, fever, frequent vomiting, inability to retain foods, continuous crying, and refusing to feed are also symptoms that must ring the alarms. Diarrhea that lasts for over a week is not a good sign either. If your family doctor thinks something else is making your baby sick, they may send you for tests in the hospital. At some point, your doctor may recommend certain treatments for reflux. If you're using formula to feed your baby, you may be given a powder that's mixed with formula to thicken it. If the thickening powder does not help, or if your baby is breastfeeding, doctors might recommend medicines that reduce the amount of acid produced in the stomach, your baby's stomach. In very rare cases, surgery might be needed to strengthen the muscles to stop food or milk traveling back up. Of course, this is done when all the options have been exhausted, or if the baby's reflux is severe. That's about it for now. Thank you for watching, and see you again next week.